Now, I came across these disease conditions when I was reading about joint laxity. So, joint laxity is basically your joints are too flexible. Okay, so they turn through a very wide range. So I was reading about Marfan syndrome, Ehlers-Danlos syndrome, Larsen's disease, osteogenesis imperfecta, and I just say fine. Let me just discuss them. So let's take them one by one. We're starting with Marfan syndrome, and this is Marfan syndrome. You can pause to observe. So all of them, you should know what they are genetic conditions that what affect connective tissues or the skeletal system in the body. You understand? So that's why you can actually confidently discuss them together. So Marfan syndrome, there's mutation in a gene known as what FBN gene, and it affects what the fibrillin 1. Fibrillin 1 is a connective tissue protein. Okay, so features, you see that the patient is tall, thin build, the limbs are long, scoliosis, chest deformities, lens dislocation, and they have all those aortic aneurysms, okay, which blood vessels could burst up, causing bleedings. So complications equally to aortic rupture, just like I was saying, eye problems and also skeletal deformities. Okay, so let's move to the next, which is Ehlers-Danlos. So Ehlers-Danlos is a group of 13 genetic connective tissue disorders. Okay, so the collagen is the one that is affected and all of that. So features is what your joints are too flexible. You can turn it to a wide, crazy range. So have the classic, we have the hypermobile, we have the vascular one. So complication is your joint could actually turn wide range to the extent that it could actually get dislocated. Okay, there's chronic pain, there's vascular rupture, there's osteoarthritis. Now the next one is Larsen's syndrome. You can pause to observe the picture. So Larsen syndrome is just a genetic disorder, and it affects how your bones are being developed. So there could be dislocation of hips, the knee, the elbows, club foot, short stature, hypermobility. A lot of things are going wrong. Okay, so complications equally to spinal deformities like scoliosis, cervical spine instability, and cleft palate and hearing loss. So osteogenesis imperfecta now. All right, almost all your bones have issues. You can see that this child has issues in the lower limb, issues in the chest, issues in the upper limb. Okay, so it's a genetic defect in production of collagen 1. Okay, so you have soft bones that are prone to fractures, are usually short, and your sclera is blue. Okay, so it ranges from mild issues to chronic multiple issues or severe issues, okay, where you're having fractures in different parts of the body. So such patients, they usually suffer from recurrent fractures. Today you are in the hospital for a fracture in a particular bone, tomorrow you're in the hospital for another fracture. You understand? So that's what we got for these conditions, basically conditions of the connective tissues and skeletal system.